Hello, and thank you for joining me today for this video on assessing someone's renal function. We will be giving a very high-level overview of the different ways we can measure somebody's kidney function. My name is John Tsai. I'm a nephrologist for the Long Beach VA Medical Center and the UC Irvine School of Medicine. First, we will discuss the concept of clearance and talk about how we can use various substances to measure the kidney function, especially substances that are excreted in the urine such as creatinine, urea, and inulin. Then we will discuss how mathematical equations can now help us to estimate kidney function from endogenous substances that we have in the human body, especially creatinine and cystatin C. The concept of clearance is relatively abstract, but really underlies how the kidneys are able to get rid of toxins and unwanted substances from the body. The definition of clearance is a theoretical volume of blood plasma that is completely stripped of a substance by the kidneys per unit time. These substances are usually thought of as toxins in our body, but also refers to endogenous substances that are produced as metabolic byproducts. Clearance is usually expressed in mils per minute, and the best substance that approximate the filtration function of the kidney or our kidney function are substances that are filtered but are neither secreted or reabsorbed. The mathematical equation for clearance is the urine concentration of the substance multiplied by the urine flow rate, all divided by the plasma concentration of the substance. Here we see an example where the urine concentration is 40, the plasma concentration is 20, and the urine flow rate is 5 mils per minute. You can see that the units of the concentrations cancel out, leaving the volume units of mils per minute, and the calculation ultimately yields 10 mils per minute here. You can imagine that it's relatively difficult to collect urine on a minute-to-minute basis, so we typically collect urine over a 12 or 24-hour period and convert that time to a per-minute basis. So what substances can we actually utilize to measure clearance in the body? And remember that these substances are surrogates to measuring the actual toxins that we are getting rid of from the body, since we don't even have a way to easily measure all of these toxins being secreted from our body. Well, there are both endogenous substances and non-endogenous substances that have been traditionally used to measure renal function. The most well-known is creatinine, which is a substance that is produced by the muscle and filtered through the glomeruli. It is also reabsorbed in tubules, so it's not a perfect measure of somebody's underlying kidney function and can tend to overestimate the clearance of other toxins from the body. But the estimate is close. Additionally, we have urea, which is a byproduct of protein breakdown. Similar to creatinine, urea is also freely filtered through the kidney, but it's also secreted in the tubules, which may actually tend to overestimate the overall kidney function. If you average the creatinine and urea clearances, you may get a fairly close estimate of a patient's underlying filtration rate, and this is typically done in practice. The gold standard has been used in research purposes to get the closest estimate to one's underlying renal function and the kidney function, and that is inulin. Inulin is a plant-based sugar that is injected into the person and is freely filtered through the glomeruli, but is neither reabsorbed nor secreted in the tubules. While this is the gold standard, it is not done in practice since it's actually very difficult to obtain and requires close monitoring of patients and their urine output. Most patients will have better things to do than wait around in your clinic for several hours and collecting their blood and urine samples to get the most accurate renal function outside of a paid research study. I wanted also to talk about cystatin C, which is another substance that we are increasingly using to measure renal function. This is similar to creatinine and urea in that it is an endogenous product to the body, and there are commercial assays that we can use to measure the levels of this in the serum. It is not affected by muscle mass, but it is affected by inflammatory markers. So together with creatinine, the combination of both creatinine clearance and cystatin C clearance may actually give a pretty good estimate of a patient's underlying kidney function. But as you may already know, we don't actually collect urine to measure somebody's underlying clearance or kidney function. Collecting urine is cumbersome, it's difficult for most patients to get right, and so researchers have actually tried to see if we can estimate that kidney function based upon blood tests such as serum creatinine levels. As you can see here in this graph, researchers have plotted out several patients' serum creatinine levels against the gold standard inulin measured glomerular filtration rate. They then came up with some good equations, as shown here, to provide the best estimate of someone's renal function based upon their serum creatinine. The most widely used equation is called the CKD-EPI equation, which was recently amended in 2001 to include only age and sex, but without a race component. As you can see, the equation is fairly good at estimating a patient's renal function at lower levels of kidney function, but there was a wide variation at the higher ends of kidney function. Also, remember that muscle mass does affect a patient's serum creatinine without affecting underlying kidney function levels, so you may have a high creatinine level without necessarily having kidney disease, and you may want to obtain other kidney function tests to confirm if a patient really does have kidney disease or not. Finally, there are calculators that are embedded in most electronic medical record systems that will automatically calculate your estimated glomerular filtration rate based upon somebody's creatinine or cystatin C. You will notice that these are standardized assays for a body surface area of 1.73 meters squared. If you have a larger or smaller individual, it may be worthwhile to compare the standardized calculation to the non-standardized calculation with a person's height and weight measurements that can be entered. Here on this slide, you'll find the calculator that is found on the National Kidney Foundation website at kidney.org/GFR. I hope this short talk gives you a better idea of the language we use when we are discussing kidney function and how it's measured. Please join me in my next video as we talk about abnormal kidney function.